Hello everyone, I'm Dr. Beatrice Hyppolite and this is your world. Hello everyone, welcome to another episode of our podcast, Your World, where we educate, empower, and inspire through meaningful conversations that improve our health and overall well-being. Today we are discussing a topic that refers to millions worldwide, but is still surrounded by myths, confusion, and silence. Menopause and andropause. Menopause is a natural transition every woman experiences, while andropause refers to the gradual decline in testosterone that many men experience as they age. Although these life stages are normal, they can significantly affect physical health, emotional well-being, relationship, intimacy, and quality of life. Today, we will separate myths from facts, discuss treatment options, explore life changes, and answer the questions many people are afraid to ask. And to do so, we have the privilege to welcome one more time in our studio, Nurse Taneesha Roberts. Welcome.
Thank you for having me.
So what you have for us today?
So, as you already said, menopause is something that is a natural occurrence. It happens with women. So there's 3 different stages of the whole thing. It's not just menopause. It's perimenopause, menopause, and then postmenopause. Perimenopause starts happening in women. It can happen usually between the 30s and the 40s, and sometimes it can happen like as young as 35, but you can start having it like in 45, between 35 and 45. That's usually around the time that women are starting to feel perimenopause. And that is the part of menopause that people associate with the hot flashes. That's when you have the onset of those kinds of things. The hot flashes, the vaginal dryness, the fatigue, the brain fog. And then menopause is specifically when a woman hasn't had a menstrual cycle in 12 months. So that's when the actual act of menopause, that's when you're actually menopausal, when you haven't had a menstrual cycle over the course of 12 months. So 12 consecutive months, no period, menopausal.
So then it's official.
Then it's official, right? It's official. And then postmenopausal is the end of it, and that's from the time that you experience menopause until the end of your life, right? For andropause, which is a similar natural transition that happens in men, around the ages of 30, 40, their testosterone starts decreasing about 1% a year, right? All men don't actually experience it. It's more, it's not that all men don't, because some men don't have it, but the majority of men experience that decreasing in testosterone 1% a year from the ages of 30 and on. That's when it usually starts, sometimes between 30 and 40.
So it is interesting that you say that it does not happen in all men, while it is inevitable that women at some stage in our life, we all will go through the process of menopause.
Right. So the thing is that what andropause is the decrease of that testosterone, like you said, right? So it's a decrease of testosterone. And testosterone is one of those things that is when you have in your blood a therapeutic range. So you peak in your 20s and you may have a really elevated testosterone. And then you get your 30s and you gradually start declining. But it doesn't mean that gradual decline is going to immediately put you in a state of hypogonadism or a risk of the testosterone being too low. You still may be within that range. Do you see what I'm saying? The process continues and your testosterone continues to deplete itself, but doesn't necessarily fall into a range where it's testable. Now in women, they don't really have a lot of tests. Because as we know, medicine primarily is revolved around men, right? The idea of women's studies and how the woman's body works and all that stuff, that was almost kind of like an afterthought. You know what I'm saying? But when women begin to have menopause, it's a abrupt drop. When men begin to start losing their testosterone, is a much more gradual kind of occurrence.
But in society in general, andropause is not something that people talk about.
No, it's
so
not.
You always hear men talk about menopause for women, and sometimes in a jokely manner.
Right.
But
Which is inappropriate, but
yeah, because at the end of the day, let me say this. Many men may say, oh, it's not a subject for me. Yes, it is a subject for you, because you do have a mother, you have a wife, a partner, a daughter, so you have a lot of women around you.
Right.
So the better you understand menopause,
the better you can support
you can
the people in your family. Yep.
or the women in your life. So it's very important for men to understand that. But to come back to the lack of knowledge that society, at large,
Right.
does not have about andropause. So it's shall I say it's sad in a way, because it's sad. That's supposed the same way that we talk about menopause. So it should have been a subject of conversation to talk about andropause. And I assume, and correct me if I'm wrong, I assume one of the reasons why they probably don't talk that much about andropause, it's because like you just mentioned earlier, so in order for somebody to say, I am in that area, so now I'm officially dealing with menopause.
Right.
You have to have not seen your period for a whole year, which is 12 months. So, and after that period, getting pregnant, it will be a no-no for you. While men, while they're going through their phases, so they don't have to experience that. With menopause, you won't be able to conceive afterward.
Right.
But men, so
they still have productive semen. Absolutely. And the thing too is, I think a lot of times the whole idea of it is overlooked because it's such a gradual thing for men. For women, we abruptly stop, our estrogen and our progesterone levels, they stop very quickly. It's a rapid thing that happens. We have a lot of those symptoms, the hot flashes that are noticeable. You'll see the fanning. But for men, it's something that happens so gradually, it can almost be undetected. And so that's why I don't think it's part of the conversation. You know what I mean? I think that a lot of times, because it's not something that we can see with our eyes, it's not something that we can say, oh, this person looks like they're extra moody or whatever the case, because it's such a gradual thing, 1% a year, it's harder, I think, for us to be able to identify and pinpoint what the symptomatology is in men. And they certainly may not, want to acknowledge that there's that they're losing their testosterone, because heaven knows they don't know. There's no man on the planet who wants to hear the testosterone is declining, annually as the time goes. But for women, it's a much more abrupt thing. And
I think, so that's just one personal opinion, because we know how men tend to, the idea of not losing their manhood, it's so significant to them.
Which becomes a psychosocial thing as well. Absolutely.
Anything around that, anything that can bring a subject that may people believe that, hey, that may happen.
Yes.
So they're not going to have that conversation.
And even when you bring that up, even when you say it like that, what we're talking about also is, like I said before, the medical congregation has really focused itself on men and the changes in the way the body works with men. That's why there's a test. There is a test for testosterone. You can go and get tested for testosterone to see where you are. Are you in that therapeutic range? There are some tests that you have for menopause in women, But generally, a lot of the symptoms, the primary care doctor will send you, or even the OBGYN will send you to other disciplines of medicine. Oh, you're having brain fog, they send you to a neurologist. Oh, you're having palpitations, they send you to cardiology. Meanwhile, these are core symptoms of things that happen to women when they're experiencing menopause. So they could be having these symptoms, and the diagnosis of these symptoms is kind of redirected to not, to the ball over there, when the ball is right here in front of your face, because they're trying to deal with the symptoms and not globally what the way estrogen has changed the way your body is functioning. Because that decrease in estrogen, it literally affects every body system that the woman has.
And I think, the symptoms are different for women. So it's like some women...
Some of them mimic each other. A lot of them mimic each other, though.
Yeah. So it's like myself. So it's like I haven't, though I already have the age, but I haven't experienced any of those symptoms.
Right. And me, on the other hand, I be hot flashed like a crazy lady.
I just call myself privileged that way. But, it's very important that you mention that there are not too many tests, that they do for women. And I think, it's very important to have, because sometimes there are some situation women may be dealing with. So while you may think, it may be a case of this or a case of that, but to come to realize it could be a case of menopause,
right,
or perimenopause.
Exactly.
So I remember, it was sometimes last year, I was watching a TV show where Ali Berry was the guest at the show, and she mentioned something that she was going through phases. And one morning she went to the bathroom. She was dealing with so much pain, she could not even move. When her partner at that time took her to the hospital, and there was like a heavy discharge. That was part of the reality that she was dealing with. To make a long story short, she said that the doctor conducted some examination, and to come to realize, the minute that the doctor saw the discharge and the color, so it's like, I may be wrong, but it seemed that it's a sign of herpes. And she said that she went crazy.
Of course.
She went crazy. And so right here, she was asking, they're blaming the game started between the two of them. Now she was wondering whether he gave it to her, or he was wondering whether she gave. So it was a whole story until the doctor called 2 days later and say, you know what, we were able to do some further test. And whatever that you experienced, it's due to perimenopause. So it was Ali Berry who had the money, the resources, and everything.
And not everybody has that money and resources.
And push her doctor to go to do further
and not
examination.
Everybody has
what
a
about the average people like us?
Yep. Not everybody has access to a physician who is going to go into depth and say, you know what, let me broaden my idea of possible outcomes or possible diagnoses, and see what other differential diagnoses are available based on the things that I'm looking at. And like I said, women's health has always kind of been like at the low end of the totem pole, because, that's the society we live in.
Okay, so I've heard, a couple years ago, where a girl who had just turned 30 and claimed that since she was 29, she was praising God for the fact that when she got pregnant at the age of 19 or 20, she kept the child. Otherwise, she probably will never be able to have a child, because by the time she turned 20, she never seen a sign of her period.
Wow.
So can menopause occur earlier than expected?
Yeah, it could, because what brings menopause, perimenopause, and all that stuff on is a decreased production of estrogen and progesterone. Now, each woman, when she's born, she's got about 1 million eggs, and every month she drops an egg or two, and that signifies that's the menstrual cycle, right? That's the menstrual cycle. The egg drops and the menstrual cycle occurs. And as you go on, you are depleting the number of eggs that you have in your ovaries. You're born with a set amount. You know what I mean? And every menstrual cycle you have, you're shedding. And so the older you get, the less viable those eggs that you have are, right? But when you're young, if you have, for whatever reason, any decreases in the estrogen and decreases in the progesterone that your body is producing, then you will experience those perimenopausal symptoms. And then, like we said, you hit menopause once there's been no cycle for 12 months. And then that's it. That's it. That's where you are for the rest of your life. You're pretty consistent, pretty stable.
But,
as far as your estrogen and progesterone.
Nurse Robert, so I know this is not your area of expertise. So you're not a midwife, you're not a GYN doctor.
Right.
But I'm grateful that you were able to educate yourself, read about the subject, and to have make today happen. So Thank you so much. I've heard somebody mention it was sometime this week. We were talking and I was excited to, talking about, hey, in my podcast this week, this is the subject that we're going to talk about. And she mentioned something that was very important. And she said to me, Dr. H, one of the reasons that I never had kids, it's because I was heavy on birth control. And by the time I was 39, I never seen my period again. Can that play a role into?
Well, birth control tricks the body into not ovulating the way that it normally did. So it's hormones that you're taking on a regular basis. And if you taking those hormones for an extended period of time decreases your body's ability to create, your body is saying now, wait, you've been drinking down the hormones. What now do you want me to do? I haven't been making it. You understand what I'm saying? So it's still, again, once that decrease in estrogen and progesterone happen, that's when the symptoms of menopause and perimenopause, that's when they initiate them. So anything that happens that's going to decrease those hormones, that's where you are.
Interesting. Very interesting. Okay. So now since we go, we explain to everybody what is menopause, what is andropause, and the symptoms. So can you give at least one or two symptoms? I know you gave the hot flashes for, can you add one or two more, and as well as for men?
Yes. So I think what I'm going to do first is I'll give one or two for women, one or two for men, and then some of the ones that they have in common. Because there are some of those same symptoms that they experience the same symptoms. Although, like I said, a woman's it's gonna happen quickly, and a man, it'll be a gradual thing over time. So for women, like we said, the hot flashes, the decreased libido, right? Those are things that happen to women specifically. For men, it can be kind of the same thing. Sometimes they lose the morning erection. Sometimes they have erectile dysfunction. And those are things that are very specific to men. Both of them experience brain fog. Both of them experience belly fat. Both of them experience decreased muscle mass. Both of them, right. So there's a lot of things that happen that mimic each other, that kind of mirror each other in the symptomatology between men and women in menopause and andropause. But we do have things that are very specific to us. Like a man, he's not going to experience vaginal dryness, right? But women will. He may have a problem with erectile dysfunction. Do you see what I'm saying? Which is why things like Viagra and Cialis, these things are so important. They're very popular because men are truly experiencing these things, and they are able to go to their doctors and say, listen, I'm having a problem with this, and that becomes a top priority. They don't say go to the cardiologist. They don't say go to the endocrinologist. They don't say go to the neurologist. They say let's get your testosterone levels tested so you can do the thing. Because you understand what I'm saying? Right.
You have to women and men. You cannot lose that manhood. But it's very important that you mention that, because oftentimes we hear people complaining about their partners in regard of sexual activity. So you mentioned where women will
have a decreased libido.
Exactly. The woman experiencing that may have a partner who will be complaining about, oh, you know what? She always refusing to, to have an adult moment.
Right. And then the thing too is that it's
for women, who have men dealing with their own experiences, they may say, oh no, who else you sleeping with?
Right, but they have a pill for their fix. You understand what I'm saying? They can take a pill and they can make it happen. Right. Do you see?
No, but before they go to the doctor to check,
Right.
this is the reality that's been going on. Because when that first happened, you don't know what it is.
Right.
And especially for men who were never educated, because women, we know the minute that we feel, we know, oh, you know what, especially if you're 40, 45, oh, you know what, it's menopause. But men, they don't know about andropause.
No, they don't. No, they don't. So that puts in their mind, I'm sure, a lot of problems with self-confidence, because a lot of men, they are, their pride is their virility. Their pride is, is their I can satisfy a woman, and I can, that's something that's really tied to their masculinity. For women, on the other hand, not only may she have a decreased libido, but she also may experience pain with intercourse because of that vaginal dryness. Do you see what I'm saying? And so now for her, it's not only just a matter of I don't necessarily want to, but also I don't want to subject myself to the pain that's associated with it, which sometimes can create conflict in relationship, because I'm sure the partner is saying, well, for 20 years, we've been just fine. Now all of a sudden it hurts. Do you understand what I'm saying? And so that creates, more rift within, I think, relationships where they aren't able to discuss the different transitions for the man and for the women, and not have it be out in the open, so that they can have some kind of a educated conversation where they can both support each other.
Exactly. That's
as opposed to
right.
As
that's
opposed
why this
to
conversation is important.
Exactly.
Because we have to understand each other's body.
That's it.
They transition all the changes that is going on in our bodies for my husband to understand, for me to understand, and for in order for us to have it, to keep on living a decent life.
That's correct. That's right.
Oh, okay. So I know this is not the end of the show, but if you were to educate men on this in terms of try to understand their women body more, so what that would be? If you were to say something.
This is a tough ask, okay? Trying to educate a bunch of men on something sometimes can be a tough ask. I think that within a relationship, the core has to be respectful. And once you are able to be respectful, when your partner is saying something to you that is affecting their body, that's affecting their mood, that's affecting maybe their desires, you have to be able to respectfully listen and validate. That's the listen.
Those are the key words.
Listen and validate. Say, you know what, I understand. And although my needs are XYZ, what I'm getting from what you're communicating to me is that hormonally, you are not prepared to maintain the sex drive that you've had for years. Physically, you are not prepared to maintain the sex life that you've had for years, because it may be painful. It may be something that it's very dry. Do you see what I'm saying? It's the tissue there. It dries. It's not, when you're young, everything is supple and lush, and now the situation is not that. You are not producing the hormones that are going to provide what it is that you've been experiencing for all those years. You just don't have it, and a lot of times you're not in the mood.
It's
right.
It's a time to have a lot of understanding,
right,
to be considerate, and not to
validate
others' feelings and understand what they are going through, and not to say, you know what, oh, you don't want to do it, I'll go elsewhere.
Right, exactly.
And it's not a time to be selfish.
Definitely not a time to be selfish. Definitely not a time, because as we know, while our change happens rapidly, their change happens gradually. And they have to think about down the road, if I do experience erectile dysfunction, if I do experience, losing that morning erection, if I do, any of these things, would I want my partner to be respectful, and to validate my situation as it currently is.
Exactly.
So there has to be an exchange. And without the education, that exchange can never happen, because you're just going by what your perceived situation is. You're not seeing the whole picture, what your partner is experiencing at the time, and helping support them get through those times.
Yeah, so it basically has to be, a we thing. Don't make it like, something
Right.
personal, like you should be the only person in the picture. So it cannot be that way.
Right.
It cannot be that way. So I'm just looking for one more symptoms: anxiety, depression. People, will have difficulty sleeping, joint pain.
All of that stuff are things that both men and women can experience. So we talked a little bit about the physical health and the mental health. We also have to discuss that, because like you said, anxiety, depression sometimes, because the fear maybe they can't perform. For both men and women, a lot of women are, they feel bad. Do you know what I'm saying? And they put a sense of guilt. They put weight on their shoulders that really has no business being there, because they want to be able to please their spouse. And the same thing with the man. He wants to be able to please his spouse, but the current condition is not allowing that. And so that can cause great anxiety. That can cause great depression. That can cause all kinds of things. But definitely there are physical effects and there are mental health effects that go along with.
Especially when you know that you are dealing with a health situation. This is a major health concern. But instead of having a partner who will understand and deal with the situation with you, but will choose instead to go out there and deal with a younger one, that can be painful.
Of course, that can be painful, and that's
very painful, that's inconsiderate and selfish. I'm gonna keep on repeating that word again and again.
That's a character thing, and andropause or not, if that's in your character, if that's something that's in you to do, then that's what you're gonna do, regardless of whether or not your testosterone is slowly right. You're gonna use it as an excuse. That's a character flaw. That has nothing to do with the actual decreasing of the testosterone. That's who you are. If that's the case, you see what I'm saying? If it's that's just who you are. I don't think that's something that says, oh, my testosterone is decreasing and my partner is doing this. If it's in you to do it, you are going to do it.
Okay, there is one of the last symptoms that I want to talk about is memory problems.
Yeah, brain fog. Something that both have them.
I didn't do any research about it to know exactly who experiences it more between men and female.
Well, so I wouldn't say one more than the other, but like I said, the difference is it's a immediate something that happens it's a rapid onset when it comes to women. So it makes it very noticeable. For men, it's a gradual onset. Do you see what I'm saying? So year after year, you may find the symptoms are becoming more and more strong. But as for women, it's like, that's it. Here it comes, and then it fluctuates until the time that you are postmenopausal, and then wherever you are at that time, that's generally where you stay. So it's noticeable in women who are experiencing perimenopause and postmenopause. Whereas in men, a lot of times it's such a gradual onset that it's like under the radar. And I think, like, again, that's why I think that so many people are not very well versed in andropause, because it's such a slow, gradual thing. It starts in their 30s and it can go up until their 80s. And by the time they're 80, they could still have a therapeutic testosterone level.
But among all those symptoms that men tend to experience, depression is one of them too. But they tend to get irritated more often than women do.
And you see that, where you hear that trope kind of in that grumpy old man thing, the grumpy old man, you know what I mean? Who the grouch. There's nothing positive to say about anything at any time. Any conversation had is a complaint, it's a gripe, it's a whatever the case. And that could be certainly tied to that lowered testosterone and that moodiness, that depression, that symptomatology that goes along with the continued and consistent decrease in testosterone over the course of decades.
But you know one thing, Nurse Roberts. So I've been around men all the time, and it's a subject that is really hard. Not andropause, but for them to lose their manhood, it's a subject many of them don't want to talk about. They don't want that to go anywhere. Even if they were to be 90 or 80, they still want to be men.
Right.
So it's like when they get to a point where, hey, it's going down, I can see the tension, the irritation.
And that's, unfortunately, that's really a societal thing. That's a societal issue, because we put so much pressure on men, even as they start with little boys. Don't cry, don't hit the ball like a girl. The idea of everything being so hyper masculinated. You know what I mean? This idea, and then once they've identified themselves as masculine, then there are certain characteristics and traits that they're going to attach to how they've identified. And they have to go through life saying, well, I identify as this. I identify, that, I'm masculine because I can bench press, 250 pounds, or I'm masculine because I can, get the touchdown. I'm masculine because I'm attractive to a lot of women. I'm masculine because, and those things, that's part of their core personality then. So as they go through life, and they see that these things may or may not be faltering, they have a problem with that, because their whole identity in masculinity is associated with those characteristics and traits. A mouthful.
It is very important, and it is a sad reality, but it is a reality for way too many of them. Hormone can change a lot of things in the body, like you mentioned earlier. Brain fog, difficulty concentrating, panic attack, but we didn't mention about panic attack. So that's my question.
Yeah. So sometimes a hot flash can turn into panic. The palpitations, all the things. So I was watching some programming, and there was a woman who was talking about how they did a study, and what they found is that estrogen in the woman's body is all over the place. And so with that slow decline of estrogen, that's when you get all the symptoms, the palpitations, the dizziness, the brain fog. And sometimes if you are, let's say you're having hot flash and palpitation at the same time, that may throw you into a panic attack, just like that, because you're not feeling safe within your body. You're feeling ill, and it's not anything that you can clearly control at any one given time. You can go fan yourself, but if you're having palpitations, it may be more difficult to be able to control that. So that kind of thing, in addition with the anxiety, can absolutely turn someone into panic. Absolutely.
Okay. I know we broadly mentioned, some impact on relationship and things like that, but to properly ask the question, how can menopause affect marriage, dating, or family relationships?